In the realm of orthopedic surgery, total knee arthroplasty, or knee replacement surgery, stands out as a beacon of hope for those suffering from severe knee pain and mobility issues. But the success of this surgical procedure doesn't just lie in the hands of skilled surgeons. It unfolds in the dedicated care of physical therapists. Before the surgery even takes place, physical therapists play a pivotal role. With comprehensive preoperative programs, they prepare patients for what lies ahead, focusing on strengthening, educating, and setting the stage for a successful recovery. As the surgery concludes, the baton is passed to post-operative care. Here, physical therapists step in with immediate interventions, employing techniques like mobilizations, range of motion exercises, and pain management strategies to kickstart the healing process. Utilizing advanced tools like continuous passive movement devices and cryotherapy, physical therapists meticulously guide each patient through their recovery, addressing swelling, enhancing mobility, and ensuring every step taken is a step towards regaining strength and function. No two journeys are the same. That's why physical therapists design customized rehabilitation plans, tailored to meet the unique needs and goals of each individual. Through careful assessment and patient feedback, these plans evolve, ensuring progress and patient engagement at every stage. The future of physical therapy and total knee arthroplasty is vibrant, marked by innovation and a continuous pursuit of excellence. From cutting-edge technologies to personalized care strategies, physical therapists are not just part of the recovery process. They're leading the way in enhancing surgical outcomes and improving patients' lives. At the heart of every step taken, every challenge overcome, stands a dedicated team of physical therapists. Their expertise, compassion, and unwavering support transform the hope of a pain-free, mobile life from a dream into reality. Physical therapist management of total knee arthroplasty, where science, care, and innovation walk together towards a brighter, more mobile tomorrow.